The ideal breast implant changes depending on the person who's having the implant placed. Silicone breast implants are constructed of a solid silicone shell, and they have a softer gel material inside of them, which is also made of silicone. Saline implants have a shell that is actually also made of a silicone material, but it's filled with IV fluid. The difference between the implants is generally how they feel. The silicone gel implants are much softer, but they come pre-filled with that silicone material. Saline implants are a little firmer once they've been placed because the saline that fills them is under a small amount of pressure. So one of the things that women will mention with the saline implant that they might not have with the silicone implant is being able to sense that the implant is in there. The silicone gel implants are very safe. In the 80s, silicone gel implants created some problems with rupture and scar formation and other things. I was one of the investigators that was enrolling patients in a study about 10 years ago in order to test the new generation of silicone gel implants and make sure that they weren't creating any kind of general health problems. There wasn't any problem that was found with the new generation of silicone gel implants. And those have provided an implant that feels very natural, provides a great shape, and is available in a huge array of sizes. So women can select a size and shape of an implant and get the exact result that they're looking for with a result that is very natural and actually feels like their own tissue. The safety of saline implants similarly is excellent. If a saline implant ruptures, patients know about it pretty much immediately because the implant deflates, but it's a very rare occurrence for that. That same thing goes for a silicone implant in that it's very rare. With a silicone implant, however, if it ruptures, it's not something that's apparent right away. With silicone implants, MRIs have to be done every several years in order to make sure that the implant is intact. And that's really the only maintenance difference that there is between the two types of implants. But I recommend that patients actually do get those MRIs so they can be comfortable knowing that they're not having any issue with their implant. With saline implants, there aren't the same considerations for monitoring of the implant. Both require implant massage, which prevents the development of a tight capsule, which can cause distortion of the implant. And you may have seen women who have had implants that look like they were distorted or very round, very hard, and that's from having a capsular contracture. And there are many ways of avoiding that. Some of it's the way that the operation is done, and some of it is what's done afterwards. And I always spend a lot of time with patients making sure that they understand all of those things so they can keep their result for as long as possible. This is Dr. Kutty. If you have questions about breast augmentation or anything else to make you look better, please give us a call. Our phone number is 281-313-0551.